We have Dr. Benjamin Hicks and Paige Fisher. What's the official title for a PH? Is it doctor?
No, it's PAC.
Okay, PAC, Paige Fisher. I know Paige is a 2015 graduate. What's that?
Paige Little.
Little, I'm sorry.
It's okay. It's okay. My last name's about to change.
Okay.
So. It's fine.
I wonder why I got Fisher. There's another Fisher.
No worries.
Okay, apologies. She's, I know she went to school with my daughter at Northwestern, so I know she is a 2015 grad. I don't know, this is the first time I got to meet you, Benjamin, so we're glad to have you here. And we're gonna expect you to tell a little bit about yourself as you come up here.
Yeah.
And we're always very pleased when people of your caliber and your occupational specialties come and say now that you are very valuable to our community. We're very glad you're here, and with that I'd like to welcome you to our Kiwanis Club.
That's high praise. I hope I can live up to it. So I hope I can remember my bio. I just wrote it down, so no. I was actually raised, I moved to Oklahoma when I was 14 years old. My dad's in the Air Force, and so he was stationed at Tinker. I went to high school in Shawnee. And then I went to OU for my undergrad in medical school. So I graduated in 2007 from medical school. And then I started my residency training in Tulsa, where I did a year of medicine and pediatrics combined. And then I did internal medicine residency in Jackson, Mississippi. So that's actually my favorite population of people to treat. So it's really applicable, and I'm really happy to be in this community because it's a community where I feel like I fit well. So temporarily I decided I wanted to be a radiologist, which from a work standpoint is not quite as exciting as being out and talking with people and interacting with people. So I actually changed back to doing essentially just primary care medicine, which is where my passion really is with people. So that's my story. That's my story. I finished 2 years ago. I was doing ER medicine just kind of throughout the state. I was doing locum tenens work. I was just working in places where I was needed. And so when I came out here, I was really impressed. I was really impressed with the hospital. I was really impressed with the staff, especially having been a lot of other places. I did some training in Shattuck in medical school, and then multiple different towns all over the state. And I was just really impressed by the quality of the staff and how well people were taken care of by the administration, the employees especially. And I was really impressed with the quality of healthcare that was available and the level of resources that were available out here. So I was really happy to be on board whenever I talked with them, whenever they asked me about the position. So we're doing some really good things out there right now. We're working on trying to improve some stuff in the ER. We're improving our treatment of acute strokes and acute heart attacks. And as you know, a lot of things have to be, well, you all probably know better than I do. A lot of things have to be flown out by helicopter, and so there's an urgency in the ER to make sure that we get things done quickly, so that there's so that everything can be treated as quickly as possible when they get to another facility. So I'm really excited about some of the changes that we're making in that area because, and I'm really excited to be a part of it too. We have a lot of people are aware of this. I think Paige has been preaching this to a lot of people, or if not, we're supposed to be. The patient portal. Yeah. So so the hospital is actually all of the medical records and the labs are available online, and there's a transition period that comes obviously with everything in medicine being electronic these days. But it's a great resource for the community. I feel that. Even if a lot of people don't know exactly what's going on with each individual number, that there's a lot available there, even if it's just relaying that information to another healthcare provider at a different facility. I have people come in all the time that pull up their labs from another facility on their phone, and so the continuity of care and the level of healthcare that can be delivered with that level of technology is really impressive, and it gets done really well out here. So I'm really excited to be here. I'm really excited about being able to feel like I'm giving back to the state of Oklahoma and the people of Oklahoma. So I'm glad to be here. Anybody have any questions?
What did your dad do in the Air Force?
He was in logistics. He was an officer. He was in for 26 years. He actually went to PA school, just started PA school. So yeah, he did. Yeah, he's 58 years old. Yep. Yeah. Yeah.
I got a short question.
Yes, sir.
In a stroke situation,
Uh huh.
if someone's brought in, you don't know how long they've been laying there.
Sure.
And you have what they call the clot busting.
Absolutely.
On
Absolutely.
hand at the time. And,
Yes, sir. Yeah. So a lot of the timing of treatment of a lot of different conditions starts as soon as someone walks in the door. So what we've done in healthcare is determined through a lot of research that there are time frames from when someone actually comes in the door that optimize the level of training or the level of healthcare that we can give. So we can't guess at how long something has happened before someone comes in the door, but we have a 60-minute time frame for administering the clot busting medication as soon as from the time that they come in the door. So we do have that available. That's only applicable to certain types of stroke. It's applicable to blood clot strokes as opposed to bleeding strokes or hemorrhage strokes. So but we have that. The level of we are completely up to date with the national guidelines on treatment of stroke in our facility. Yeah.
Can I ask one more little part of that question?
Sure.
You mentioned, I'm glad, but how do you determine immediately whether it's a brain hemorrhage or a stroke?
Right. So actually,
You know what to give the blood clot.
yeah. So we do. So it's a CT scan. We just CAT scan the brain. We can get that done within a few minutes of someone coming in the door. And so we do that. And when we do that, we can just see on the imaging. It's kind of crude, but we have to get it done as quickly as possible. But that's our best indicator. We can tell a little bit by symptoms too, by what somebody looks like. But yeah, it's imaging. We have good imaging over there too.
If it's longer than 60 minutes, does it do more harm than good, or is
It
it
can.
just not effective?
No. Yeah, the administration of the medication. Yeah, so it's just as effective. It does exactly what it's supposed to do, but the outcomes, as far as it does not worsen. It doesn't make anything worse at that point. It's just not as effective. Yeah.
I believe the hospital announced that you have moved from the physician's clinic at the
That's right.
hospital
That's right.
to the downtown clinic. Has this changed your practice any?
No, it hasn't. That's a good question. It's just adjusting to a new place. I've been talking with the administration about moving down there initially, and I like being in a place that's a little bit separate from the hospital sometimes, and then I come over to the hospital and do the urgent care work sometimes in ER as well. But that hasn't really changed anything there. I think I've got a really great staff over there. They're really great. They're solid, and so they've done a good job of acclimating me to a new place, and I've really hit the ground running. I've been there for about a week now, and yeah, better. I can say that.
I'm supposed
It's
to
good.
take a staff picture of it next week
Over there?
of all of you. Yeah.
Okay, I'll make sure all the ladies know.
Be pretty.
Okay. Sure. Yes, ma'am.
So who are the ER doctors?
Okay.
And where do they come from? Because it's not just you and Dr. Lawrence, right?
That's right. So the hospital, and I kind of pushed for this a little bit, the hospital has hired permanent positions for most of the provider positions in the hospital. So rather than having I originally came out working just a part-time contract essentially with the hospital. And so the continuity of care, as in the communication among doctors, is so great now. So she's hired on Dr. Kortner, who is, I think he's out of California, but he flies in and he stays for days at a time. He stays in 4 to 7 days at a time, sleeping in the hospital. And then anytime he's had a difficult night or he's got multiple patients or multiple things going on at once, then either Dr. Lawrence or I can go over there and help out. Paige can go over there and help out as well. It's really great that we can kind of shift people around. So we have Hina Ray, who's a PA that came in from New Jersey. She's full-time staff now also. We have Emily Nyer. And then, is that it? You? We have you?
I haven't worked in the ER yet, but it's up and coming.
But she's capable. She's beyond capable. Well, I'm biased because she went to the same school I did, so. But I can speak for that.
Flying in from other states.
That's right.
Doing their practice here.
That's right.
And then they go
Right.
to another gig.
Right. Well, Dr. Kortner, I think, doesn't have anything else going on. I don't think Hina does either. the thing that works for urgent care and it works for ER, it doesn't work for where we need to be able to follow patients over long periods of time. So yeah, that's pretty standard, and it's a standard practice for, especially, I'm really glad that we've gotten on people for a long period of time, because when you have somebody that's in there temporarily, it's just puts a whole bunch of different logistical issues in, you know. So yeah, it's good. Yes, sir.
You just might mention to the Emily you were talking about that her maiden name was Emily Davis.
Okay.
That's Larry Davis's daughter.
Okay.
So most of the people here would know who that is. They wouldn't recognize her very well.
Okay. Is that recent? Is that
She's
something
from here, but she lives
Okay.
in Edmond.
Okay. Yeah, she commutes up. Yeah, that's right. She stays for a few days at a time too, doesn't she? Yeah, she does. Yeah.
Tell a little bit about your Africa experience.
Yeah. So I studied abroad. It was essentially a study abroad, just like is done in college, I guess, over in South Africa, in the capital in Pretoria in South Africa when I was in medical school. And talk about a culture shock. It was a completely different, obviously, culture, but the medical culture was very different too. So terminology was used differently. The level, the way that responsibilities were delegated was completely different. It was extremely hands-on. As a U.S. trained medical student, we had a level of training or level of education that was comparable to all of the physicians in the country. So we were given a lot of responsibility, and worked in the ER, and then saw patients on the floor as well. It was a great experience. I felt like it really diversified my education, exposed me to a lot of things that we don't see. Being trained in one area, I'm really glad that I went to Mississippi, because being in the U.S., it's still different. See a lot of different pathology, different diseases, and then different stages of things as well. And so I definitely got to see a lot of people who not had any health care whatsoever when I was in South Africa. So I saw a lot of different things. I really felt it helped my education a lot. Yeah. Yes, sir.
We've got a lot of time left for the program.
Yeah.
Is that young lady going to come up here and talk?
She told me to hold out, actually, as long as I could, because I left her hanging.
Take all the time you want.
No, yeah. I do actually have to get back over to get some work done, so if you're ready, Paige.
Sure.
Yeah. I look forward to meeting you all. Thank you.
Well, that will be a little bit hard to follow up. Well, I'm Paige Little right now. I'm a PA, or PAC is my given title. I work up at the physician's clinic with Dr. Lawrence right now. I'll tell you a little bit about myself and then kind of what a PA is and clarify any confusions there. So I was born and raised in Edmond, Oklahoma, and went to Edmond Memorial High School, graduated there in 2011, and then in the process of trying to find out where I wanted to go to college, I got a call from Shane Hansen, which I'm sure that name rings a bell. I'm seeing some head nods. I ran cross country all through college, or all through high school, and so he called me and was like, hey, you want to come out here and maybe run for us? And I was like, sure. I've never heard of Northwestern, but let's give it a try. So I came out, ended up really just loving the community and the town, and just like the unity I feel like that the town has. And so came out, ran cross country here for 3 years. And in the midst of that, ended up meeting my now fiance, Sammy Kirkenberg. So I'm going from Little to Kirkenberg, so it's going to be a little bit of an adjustment. But so we're getting married June 9th this year, so in about 2 months. So things are getting a little crazy. But I graduated from Northwestern in May of 2015 with magna cum laude, which just in honors. And then had applied to PA school during my final year, decided pretty much my sophomore year that that's what I wanted to do, was go to PA school. So lucky enough, got my interview, was accepted, and started PA school 2 weeks after I graduated. So graduated in May and then hit the ground running June 1st down at OU. So I had to pack my bags and get down there. So a little bit about the PA program at OU and what it's like. There's two portions. There's the didactic portion and the clinical portion. So didactic is basically 15 months of strenuous in-class work. I kind of correlate it to like a fire hydrant in somebody's face. That's how much information is coming at you at once in PA school, because in a sense, it's almost like 4 years of medical school shoved into a very, very small portion of time. We learn the same curriculum that medical students learn. We do the same procedures. Everything is the same. We just do it in a very, very short amount of time. So we would go class 8 to 5 all through the summer. We even had some weekend classes. And then once you finish your didactic work, you go off to clinical rotations where you'll do certain months of different types of medicines and primary care, pediatrics, dermatology, ER, internal medicine, all those, and we get that under our belt. And then once we finish that and pass our required testing, we graduate and we take our boards, which is the PANCE, the PANC, Physician Assistant National Certifying Exam. So that's a little bit about PA school, and they're different. All the programs are different, depending on where you go. But that's how OU's was. And so I just graduated December 1st from OU, and then came up here, and in the midst of all that, took my boards, passed my boards. That was a huge lift off my shoulders, and started up at the clinic about February 1st. So as a PA, I always have to have a supervising physician, and that's anywhere across the nation. And there's certain rules that differ per state, but in Oklahoma, I always have a supervising physician. So Dr. Lawrence is my primary supervising, and then Dr. Hicks is my alternate. So if I ever had a question, wasn't sure on something, or needed help with something, and I can always go to them. And it'll be like that until I retire, as far as a physician, that you never practice solo. But with that being said, I can see my own patients, I can order my own diagnostic testing, my own labs, I can treat like a physician can. It's basically the same thing, except for PAs don't have the residency that a physician does. So we can train multiple ways, go to multiple specialties. We just always have somebody we're training under. So that's basically how my training went. And like Dr. Hicks, I went all over the state too. I was in Durant, Tishomingo, up in Tulsa, up in the Claremore, Oologah area, some in the city, mainly up it, but I didn't have any out here. I tried to get them to send me to Northwestern because this is where I know everybody, but I didn't end up getting out here. But I had one rotation with Emily Nyer. She was my preceptorship over in the ER. So I worked there in November of last year, and then graduated, of course, December 1st. So right now I am just at the physician's clinic, just doing the clinic stuff, family medicine, but eventually would love to do ER. It's just a big step to go into the ER versus doing clinic medicine. And I'm glad that Dr. Hicks trusts me enough to do that, but until I feel ready, I won't be working the ER, but I do love ER work because I've done quite a few rotations in the ER. And a little bit as far as like what I like to see in the clinic, I think Dr. Hicks said he likes internal medicine, which is mainly adult medicine. I love pediatrics, so I would love to have more pediatric patients. Not that I don't like adults, but I do love the pediatric population, and I also really love dermatology. That was one of my favorite rotations as a student. Of course, I didn't do a residency in any of those things, but I do love those things, and try to stay up to date on all those things as much as I can, which is part of being a PA too, and also physicians. We have continuing medical education every year. We have to have certain hours, and so that's a little bit about me. And I, of course, wanted to come back to Alva because I just loved Alva so much. When I was here, I just people are nicer here, and I hate to say that. I grew up in the city, and people are great in the city, but people are just more laid back and relaxed and appreciate you more here. And Sammy's from Moreland, my fiance, so we just decided let's just stay in Alva, where we belong. And I knew there was an opening at the hospital, so went ahead and applied and got my interview and just decided to come back. So any questions for me or anything else about me you'd like to know?
What kind of work does your fiance do?
Sammy is a welder, so he does, and we also own cattle. So we just got 10 babies and 10 mamas, but he does welding, so not pipeline or anything, but mainly like corrals, farm welding. So he works a lot in Carmen and Tacoma. So if you ever need a welder, let me know. I'll hook you up. Yes.
So in order to go into, you kind of alluded to this, but to go more into ER, would you do like a concentration, like a residency, or is it just getting more time in there?
It's just getting more time. So that's one of the reasons I chose the PA profession. Is the beauty is I can switch and do whatever,
Okay.
field of medicine that I want, whenever I want. Physicians, they do their residency in one specific thing, and then they can't practice anywhere else. That's what they have to do. So that's why I liked PA. I was like, well, if I get bored, I don't want to say bored, but if I want to try something new in 10 years, I can do that. And I can just, I have a supervising physician that'll train me the way they want me to do medicine or do whatever it is, and then I can go into it. I'll probably start just spending some weekends in the ER though with like Dr. Hicks or Dr. Lawrence or Courtner or whoever's working, and kind of just work with them and get the better training that way. And once that I feel ready and they feel that I'm ready, then I would eventually start. But for now, I'm just doing urgent care and the clinics in family medicine.
So if you hit Alvin in February, did you see any flu symptoms?
Oh my goodness. It was only flu and strep for about a month. Everybody was sick, and we're still seeing a little bit of it, but it has slowed down so much, and I'm very grateful. Now it's allergies. So it went from flu to now everybody's sneezing and coughing like crazy. So, it's one or the other. I saw you raise your hand. Yes.
I did. I was curious about if you decided, darn, I wish I'd gone to med school so I could go somewhere and practice where I was needed by myself.
Mm-hmm.
Is there an advancement as you get further on and have been in practice longer that would allow you to do that?
There is a way for PAs to own their own practice, but it's kind of weird per state. You always have to have a supervising physician. But I don't know the exact answer to that. I know that people do it, and I know it's a possibility, but the business behind it I'm not very sure on. But I don't regret at all going to PA school. I really like that I'm 25 and done with school. It's awesome. It's really awesome, and I love, and it's a constant learning anyways. I mean, even as a physician, medicine changes every day. Diseases change all the time. It's always changing. So you never stop learning. Even if you're a physician, PAs, we learn all the time, and we just continue to learn. And I'll see something new every day and have to read up on it and, make sure I'm doing the right thing. And that's just part of the profession. But no, I'm really glad that I chose to go to PA school because of the flexibility, I think, is the big thing. And then I can have a family, not anytime soon, but a family, and not, feel like having a ton of stress on my shoulders as much as, a physician might. But I hope that kind of answered your question in a way.
Pretty much.
Okay.
Doc, maybe you can serve as her physician overlooker, so.
He's a veterinarian.
Oh, I was like, I don't recognize you. Okay.
I thought everyone.
It might be a little different, but.
He's a retired veterinarian.
Okay.
Listen, don't laugh. We have great respect for veterinarians.
Oh, yes.
They're the only doctor I know that can make a diagnosis without asking the patient a single question.
I totally agree with that. And I expect to take my dogs, which I have 2 dogs that I love dearly. They are my babies, and I expect them when I take them to the vet that they get taken care of. So,
And
yes.
Where did you get your earrings?
I have no idea. I don't remember.
Are they Kendra Scott?
They are not. I do love Kendra Scott, though.
Look at you, fashionista.
He knows his stuff.
Who would have thought?
I actually have no idea where he is. I don't remember.
Any other questions?
Anything else?
Relevant to the
Paige, thank you.
Thank you so much for having me.